I've got a medical experience that's really was a nightmare. Many years I've been dealing with some foot pain, letting it go, taking aspirin, what have you. And about 7 years ago, I finally started looking at going to doctors and having it looked at. Gone through neurologists, x-rays, blood tests, different doctors, 6 different podiatrists. In that time period, what I was given, I've got neuromas, which are inflamed nerve endings in my feet, and doctors were giving me narcotic pain pills, psychotropic drugs, nerve drugs, and finding that doctors are saying that these psychotropic drugs that are used for depressions and anxieties and whatever else is also being found to have benefits on nerve problems. So I began taking those drugs, went to different doctors and so on. Got to the point where I didn't like taking those drugs. But in the meantime, I also found that I started having some issues with anger, getting upset with people, a short temper, so on. And in talking with some people that directed me to getting my thyroid checked and finding that I had low thyroid, or I was hypothyroid, and then watching blood sugars and stuff, noticed that there were some weird things going on, but I, not knowing much about medical field, my background is more in diagnostics and troubleshooting diesel engines, automotive, large marine and industrial rotating equipment, all the way down to automotive and motorcycles. I worked on high performance and building engines. I had my own shop in Houston, but my strong points is diagnostics and troubleshoot. Thank God, because of the fact that with what was going on with me, I had eventually been able to get the issues to find out what was going on rather than what was happening on the surface, and what these, I'm going to say it lightly, so-called doctors were misdiagnosing me with. I began going to one endocrinologist and did the basic Western philosophy of thyroid testing and doing the very basics, and noticing that my thyroid was low, hypothyroid, began me on supplement, levothyroxine or Synthroid. Did that for a couple of years. I noticed that there was some still issues with anger that I didn't like. So with myself, I found out that I was just like short-tempered, and I got to the point where I get angry and I didn't like myself even. So I looked at some psycho doctors to try and get some help with anger issues. Began going to a set of doctors. I say a set because one is the therapist, the other is a medical doctor that actually prescribes the psycho drugs. Went in, began seeing the therapist, did my time, went to the next doctor, the one that prescribes. In 10 minutes, he's telling me I've got ADD or ADHD. I've got depression, I've got this, I've got that. He starts writing me prescriptions. He also sees that I'm already on a psychotropic type drugs, and also, actually at one point my blood sugar was up and down, but not understanding why. The endo put me on metformin, blood sugar medicine. Alright, so I'm on things like gabapentin for nerves. Geez, I can't even think of all the drugs. Even stronger psychotropic drugs. The new doctor gave me the stuff for ADHD, depression. So I began taking these things thinking they'd make me feel better. Maybe this anger thing will go away. After about a year and a half of this, I realizing that this stuff is just making me lethargic. I was getting depressed. That I noticed depression. I was just feeling horrendous, bad, no energy, no motivation. If I had one of my high-performance motorcycles running, I would have probably taken one at about 150, 60 miles an hour into a concrete embankment. That's what that stuff was doing. At the same time, I'd even be driving back from Albuquerque and in the car and be looking at a guardrail and looking at it thinking, oh, how fast can I get this car and take it straight into the end of a guardrail. That's what those drugs were doing to me. I'm getting a better understanding of what's going on with a lot of this evil stuff out in the world right now, that's being used for political reasons, and the fact that these people are on some of these psychotropic drugs, which is being held from the public. And there's a major concern there, folks, because those drugs are not good. There's no testing on them. The testing that is being done right now on you and me, just as we speak. Doctors don't know what those drugs are doing. They're mixing them. Let's see how you feel. They'll dump something on you. Oh, 3 or 4 drugs, actually. And then they'll say, well, let's see how you feel. You go in and back and see them. There's no testing for this stuff. There's no diagnostics. There's no blood test. There's nothing to find out what it is that you really need. An article came out today on the internet. Believe what you want. American children are taking psychotropic medications at an alarming rate. Children. We have 24 million children on ADHD medication. 10 million are on antidepressants, and another 6.5 million are on anti-psychotics. Just with those 3 categories, that's over 40 million kids, not to mention the over 250 million prescriptions that are written for kids yearly. Has kids gone mad? When I was growing up, it was called a type 1 or 2, type 2 or type 1 attitude, or whatever it was called. I can't even remember. I was a type 1. Okay? Now they're putting people on drugs because the type 2s can't handle the type 1s. The drug manufacturers are putting these drugs out on emotions, human emotions. That's all, folks. Human emotions is what's driving these drug companies to produce drugs, mind-altering psychotropic drugs These drug companies are making the manuals, the instruction guides, the books, the teaching curriculum for your medical students. Don't believe me? Go look it up. They're writing those books and putting their drugs into those manuals for use of the effects on the problems. The drug manufacturers are writing the books. In other words, they are brainwashing the people that want to be doctors and that are becoming doctors. That's all it is. It's a brainwash. Just like your Common Core teaching. And what's being done in the medical facilities today with the medical field. Let me tell you something. Those drugs almost killed me. Those drugs, I was not depressed per se. Everybody gets depressed at some point in their lives. No. I will tell you, I did not go and listen to what those doctors were saying. Because I tell you what, one day I began starting having anxiety attacks. I didn't know what they were. People thought I was having heart attacks. Well, one day I was out here on the bank, on the ditch bank, walking my dogs, and I had an anxiety attack. Put me on the ground. Now, it may get weird for you, but this is what happened. I was on all fours, and I had this white cloud energy, whatever you want to call it, Jesus, an angel, up in front of me. This thing was probably 10, 12 feet tall. And all I heard was this: get off the drugs. Get off the drugs. Thyroid. Thyroid. I wound up at the emergency room that day, later on. They thought I had a heart attack. I didn't. Wound up being an anxiety attack. I then began listening to what happened to me. This entity came to me and told me, get off those drugs. I got off those drugs. Thank God I did. Just before this, my wife began taking me over to getting acupuncture for all of my medical issues. Not only the neuroma, what I have found in the thyroid, and we'll come to it, but there were some other issues going on. I was also having diverticulitis. I've had it for technically for many years, but I definitely had it on the day after Thanksgiving on 07 when I wound up in emergency at the hospital and had diverticulitis and pancreatitis at the same time. So, here we are in August of 2011. Laying on the ground, having an anxiety attack, thinking it's a heart attack. Being told to get off these drugs. I get off the drugs. I'm on acupuncture. Thank God I did. I also changed my endocrinologist. Got a different endocrinologist due to the fact that it seemed like I wasn't getting full representation by my first endocrinologist on my thyroid. I began seeing another endocrinologist. I got off all the drugs. I stayed on the end of the levo. I got some blood tests going on. Within a month, I started back on the correct dose of thyroid medicine and doing acupuncture. My doctor of Oriental medicine, my acupuncturist, also recognized at this time I was having a typical classic case of Hashimoto's. In December of 2011, he had me tested, and my antibodies test came out off the charts. Both of the readings were off the charts for Hashimoto's. I go to the endocrinologist. I question him about this. He tells me I'm crazy, that I have some medical issues, some mental issues, and I need to go see a psychiatrist or psychologist. I just got away from them. I just got away from those drugs that they had me on. That upset me. That angered me then. Yes. So, from that point on, I began believing Eastern medicine over Western medicine, and educating myself and finding that Western medicine does not really acknowledge Hashimoto's. And there is no other treatment except for, in Western medicine, is to supplement the thyroid gland. Well, in educating myself, Hashimoto's is actually an autoimmune problem. It is your immune system actually attacking a perfectly good thyroid. And it'll keep doing it until the thyroid is no longer good. And it's a dead thyroid gland, as I understand it. Western medicine, all it does is supplement the thyroid. So, I stopped going to the second endocrinologist. I stayed on my current dose of thyroid medicine, supplementation, and stayed with the doctor of Oriental medicine and my acupuncture. With that alone for more than 6 months, and then getting retested for my thyroid, my antibodies numbers have gone down quite a bit. It's also in changing of many things in my diet and so on. There is no cure for Hashimoto's. Western medicine is barely finding out about it. One day I was going to go get tested, blood tested for Graves' disease and checking the antibodies on the thyroid for Graves. Due to the fact that I had symptoms of Graves, and my doctor of Oriental medicine wanted to check. I went to get a blood work done, and this happened this year in 2013. About a week previous, I had one of my diverticulitis attacks and wound up at my doctor, and he took some blood work, and I asked to get some antibodies tested as well. From a week, there was more than a difference in one of the numbers, and I don't have that directly in front of me, but it was by accident that when I went to go get my antibodies tested for the Graves, which was a week after the other blood test, I noticed that I was having this feeling of the Hashimoto's attack. I was having thyroid glands swollen. They were sore. Another thing that I've noticed, and I've got documented, and this is probably very hard for Western medicine to understand or recognize or even believe me, that I have noticed that when I'm having these attacks, these Hashimoto's attacks, my mood changes, completely changes. Very short with people. I'm very easy to argue or get angry and bring issue. I've also noticed, and this was by accident, and this is where I started following this, my blood sugar. My blood sugar, when I'm having these attacks, skyrockets. My normal blood sugar is between the 90 and 125, maybe 130. And that's, typical times of when checking. You eat and of course it goes up. But I have noticed that, when I do a heavy eating meal, my blood sugar may go to 150, 160. One thing I've noticed that when I'm having these attacks is my blood sugar skyrockets over to 200 and even higher. Now, I have been on the metformin previous because of my A1C, and we've noticed that it went from at one point 10, and I've gotten it down to 5.6 just by changing my diet. I got on metformin and found that it would actually bring my blood sugar down to the 60s and 50s before I was sucking wind and looking for something to get me some sugar fast, very fast. So we had to stop and back off the metformin. I haven't been watching it lately, but I do notice that checking the blood sugars when I do have my Hashimoto's attacks, whether Western medicine believes this or not, because it's not very well documented and hardly at all. And like I said, this was just by accident. So it's something that they may want to look at. Now, in the meantime this year, I have been fighting with the diverticulitis. Earlier this year, I had 3 attacks. My primary doctor said fourth one I'd be in emergency. I wound up in July of 2013 at emergency. I had a diverticulitis attack, very serious attack. I won't go into what happened at the hospital. Basically, I did not get anything fixed. So for the next few months, I'm trying to get some things looked at. I'm looking for a new thyroid doctor, endocrinologist, and I'm looking for a surgeon that will cut out this bad piece of colon. Took me about 3 months. I finally got into some doctors. The endocrinologist noticed some things about my blood work that he didn't like. He had me go to a oncologist, hematologist, and in which I was checked for leukemia and some other items, cancer type things, and all came negative. In the meantime, in October, I was able to get a surgeon to cut out a section of my colon, my large intestine, that had the diverticulitis. It was so bad that it was actually began attaching itself to other organs. That was on October 4th. It was removed. 10 days later, I seemed to have a possible have had a heart attack in which I had a near-death experience. I will tell that story in a few minutes. On the morning of Halloween 2013, I woke up in the middle of the night with chest pain. My wife rushed me to the hospital because she noticed I was having a heart attack. I had a 100% blockage on my main artery going out of my heart to my body, and a stent was put in. I also have currently a 60% blockage to the heart on the main vein or artery that's called the Widowmaker. So my life has changed considerably. A couple of things. Number one is that thank God that I was given the intelligence to be able to diagnose and troubleshoot. Yes, it was in mechanics, but I was able to put that to work in my medical, because of the fact that medical doctors, all they wanted to do was give me pills. I thank God that that apparition happened, or whatever happened that day, got me off those medical drugs, those psychotropic drugs, those very powerful mind-altering drugs. And I can see how those drugs would actually make someone do bad things. I had a couple of friends that were on those drugs. Their doctors had problems trying to adjust them, and they both wound up killing themselves. I could see that. With those drugs having me with the thoughts of crashing a motorcycle at 160 miles an hour into a concrete brick wall. I can see the violence that's going on around this country and the relation to what those drugs are doing to people. You better look at the main sources behind those drugs. The drug companies, you better look at the Federal Drug Administration, the DEA, the medical field. You need to look at them, because what's happening here is criminal. Everything comes back to, with my issues, was physical. Once that diverticulitis chunk was taken out, all the organs on my left side of my body that were sore and swollen calmed down. My liver was inflamed. It had created so much heat in my body that it actually created my feet felt like they were on fire. They were literally red. My feet, even though they're still in pain, the pain was excruciating to the point where there's days I couldn't walk on them. The redness was so red that you could feel the heat. My feet have so many bone spurs on them because of this, and my body trying to cool them off. That's what I understand both Eastern and Western medicine do have an agreement upon. That your body, when it overheats, creates bone spurs like a radiator and tries to cool itself off. Since the foot of colon was taken out, the redness in my feet immediately went down. My doctor of Oriental medicine can acknowledge this. The thing with anger, that these medical doctors and psychic doctors seem to not understand, is that, and I have found out from endocrinology and hematology, that low red blood cells can make a person angry, as well as low testosterone. I thought it was high testosterone can make people angry. Also, low testosterone can do the same. I have both of those. And living with the pain in my gut, with a colon that was actually attaching itself to other organs in my body, it had to be cut apart before the doctor could actually take the colon out and then cut off the bad section and reattach it. The doctor told me that my colon was actually enlarged at one end, and on the inside it had collapsed. And actually started attaching itself as well on the inside of it. All I know is I was to the point of anything that I try and eat would come out. It would come back up, and whatever went through would go blowing through with diarrhea everywhere. I've lost over almost 60 pounds. And, you know, it really took an act of Congress to get me into a surgeon. And then finding out that the type of condition that I had is not normally operated on until one has a blowout of the gut, of the intestine. I met somebody that his is so bad it's bleeding, it's contaminating his blood, and he has to get 500 liters filtered every 2 weeks because his blood is so septic, because he's got such holes in his colon, and this is not something that's normally operated on. I'm very fortunate. Thank God I am so fortunate that I was able to find a surgeon. And I have to thank Presbyterian Hospital in Albuquerque and Dr. Gregory Garcia. I have to thank him so much for giving me my life back. Another woman, Betsy, She's a nurse. She's a nurse advocate that assisted me from July until I got my surgery done in October. 2 weeks after my surgery and I'm home, I have a heart attack. It's been one hell of an October. Again, Presbyterians saved me. I got to thank them again. Now I've got something else. See, when I had that apparition or vision or whatever telling me to get off those drugs, I believe very much it was God or Jesus. And I listened. My wife didn't like it. My doctors didn't like it that I got off those drugs. Thank you, God. And I must say that happened in August of 2011. 2 months to the day of my 53rd birthday, I went to church and asked God for forgiveness and asked Jesus to come into my life. 2 weeks later, I got baptized, rebaptized, reborn. I decided to turn my life over to Christ and let Him lead me. Now, during all this other time, prior to moving into this house and having the medical issues, I thought everything was going okay. We moved into this house and all hell broke loose. I had a neighbor that was harassing. He called the cops when he didn't like something. Cops began harassing me. As soon as we moved into this house, I noticed issues with the house. Fraud and forgery all over the house. That will be on another video. That's going to the feds, the FBI, the governor's office of New Mexico, and many other people. Because what was done here to this house was criminal with this deal. Now, the same with the neighbor and harassment. When that began, I immediately addressed the police and told them that it is harassment. I also went down to the city, had a meeting with the city manager and some others, also with the police chief. Told them I want the harassment stopped. We had a meeting, the chief and the next door neighbors, about stopping the harassment. Part of the fraud and forgery was the property line, which was 4 feet 2 inches into taken over by the neighbor into my property. Well, between the house deal, the realtors, the mortgage company, the title company, the neighbor, the police harassments, the medical issues I was going through, life was hell. Life was real hell. And that was the main reason I turned my life over to Christ, because I couldn't deal with this anymore. In doing so, between the time I had the surgery in October on the 4th and the heart attack on Halloween, I believe there was another night I had a heart attack and went on a spiritual journey, which I'm finding out now people actually call near-death experience, out-of-body experience, what have you. All I know is it changed my life. It changed my outlook on everything. Everything. You know, what we do on this earth does not matter. It's only what we do between us and other people. Between ourselves and others. That's all that matters. I won't go into this full story on this video, but I'll make another video about my experience. This video is primarily for the medical aspect, in that you and I are nothing but experiments and a cash flow for drug companies. They're trying to find out what these drugs do to us because there's no other way to test them. You see, there is ways to find physical aspects of things, and that's blood tests. I think there's over 600-700 different types of blood tests. I don't know. I'm not a doctor. But I'm sure strong in my troubleshooting and diagnosis. And unless these doctors are actually diagnosing, then I'd stay away. If they're just throwing pills at you and saying, well, let's see what they do to you. And especially when you got these psycho doctors. You know, many years ago, psycho doctors used to actually take those pills to see what they do. You think these doctors will do that now? No. All they're doing is medicating and starting with our kids, our children, with very mind-altering psychotropic drugs. Do you know how much that affects people in the way of their creativity? Maybe they got some good ideas. Maybe you're drugging somebody that's a brilliant mathematician or scientist that could figure out cancer or AIDS, or get a rocket to pass Mars with people on it. You know, you better look at it. What's going on today, folks? The Western medical field almost killed me. Literally. And if I didn't fight and understand the diagnosis and troubleshoot and educate myself and keep pushing to find those doctors, the other doctors are they'll just blow you off, give you a pill, and send you down the road. If it doesn't make you feel better, they'll find some other pill. Thank God I didn't go down those roads. Thank you, Jesus. And I pray for everyone that's following that road. please go get physical blood tests done. Because come January, it's going to be a worse nightmare than you can ever imagine if something doesn't change.